Hi everyone, this is Avneet and today we'll start with Ophthalmia Neonatorum. So this is a series of mostly left topics. What is Ophthalmia Neonatorum? It is bilateral inflammation of conjunctiva in an infant less than 30 days old. एक इन्फेंट में अगर कंजक्टाइवा की इन्फ्लेमेशन हो रही है बायलेटरली इट इज़ नॉन एज ऑफ्थेल्मिया नियोनेटोरम. ठीक है, वी कैन रिमेंबर इट बाय CON cone conjunctiva ophthalmia neonatorum. Okay, so uh, after that, what thing like arises the suspicion of ophthalmia neonatorum? It is any discharge or even watering from eyes in the first week of life, because tears are not formed till then. So if there is any discharge, any watering from the eye in first week of life, we should suspect ophthalmia neonatorum. What is the source and mode of infection? So, infection can occur before, during, or after birth. Before birth is very rare. It can be due to infected liquor in mothers with ruptured membrane, and during birth, if the delivery is vaginal, the most common mode of infection is from infected birth canal, especially if the child is born with face presentation or with forceps. And after birth, infection may occur during the first bath of the newborn, या फिर from the soiled clothes or fingers with infected lochia. Then these are the three mode of infection. Then causative agents. There are five causative agents. The first one is the chemicals. Chemicals, it can be silver nitrate, which was used in older days, or antibiotics used for prophylaxis. Then there can be gonococcal infection. Then there can be other bacterial infection, which can be due to staph, strep, hemophilus. Then there can be neonatal inclusion conjunctivitis, which can be due to chlamydia trachomatis, and it is at present the commonest cause. Then there can be herpes simplex virus infection. So we need to remember five things: chemical, gonococcal, other bacteria, chlamydia trachomatis, herpes simplex. And most common causes chlamydia trachomatis. So first of all, clinical features. तो उसमें सबसे पहले incubation period. So incubation period can range from hours to days. Chemical, if the causative agent is chemical, incubation period is 6 hours, and the longest is with herpes simplex, which is 6 to 15 days, and similar period is for chlamydia trachomatis. Then what are the symptoms and signs? So first of all, there will be pain and tenderness in the eyeball. Then we already saw any discharge, so conjunctival discharge. It is purulent in gonococcal infection and mucoid or mucopurulent in other bacterial cases and the trachomatis case. Then lids are usually swollen. Then conjunctiva may show hyperemia and chemosis, and there might be mild papillary response. But follicular response is typically absent. So अभी तक हमने क्या किया? पेन एंड टेंडरनेस, discharge, swollen lids, hyperemia, chemosis and conjunctiva, mild papillary response, and the last is corneal involvement, which is rare, but it can occur in form of superficial punctate keratitis. So we need to remember 5 causative agents, then 5 symptoms and signs. Complication, it may develop corneal ulceration and which can perforate, resulting in corneal opacification or staphyloma. Then prophylaxis. So prophylaxis is antenatal, natal and postnatal. In antenatal, care of mother should be done, and all the genital infections should be treated whenever suspected. And then in natal measures, the delivery should be hygienic, and the newborn baby's closed lid should be thoroughly clean and dried. Then a postnatal measure. So povidone iodine 2.5% solution is used, and we can also use tetracycline or erythromycin ointment. And if the mother had gonococcal infection, single injection of ceftriaxone IM or IV is given to infants. Then treatment. So this was prophylaxis. Now going to treatment. First of all, if it was chemical, it is self-limiting and it does not require any treatment. If it is gonococcal, there is topical therapy and systemic therapy. In topical therapy, we have saline lavage hourly, then bezitracin eye ointment, and penicillin drops, and if cornea is involved, then atropine sulfate. In systemic therapy, we have ceftriaxone or cefotaxime or ciprofloxacin. And then in other bacterial, we have a broad spectrum antibiotic for 2 weeks. In trachomatis infection, we give topical tetracycline. And in herpes simplex, it is self-limiting disease, but we can give IV acyclovir. So this was all about Ophthalmia Neonatorum. So revising it, what we saw, first of all, its definition, then when do we suspect it, 3 source of mode of infection, 5 causative agents, their incubation period, 5 symptoms and signs, prophylaxis में 3 antenatal, natal and postnatal. After that treatment में all the 5 things की 5 treatment.